O'Neill. Nice to meet you.
Nice to meet you, sir.
Glad you came out.
Hey, I tell you, I'm proud of you. That's a.
It is not a piece of cake.
I told somebody it's one of those ones where when you start doing it after a while, you go, what was I thinking?
Well, the first day I walked 5 miles to get ready for it, I was like, what have I done? I don't know how long y'all want me to talk. I got a lot to say.
He's excited.
Yeah, he's excited. First off, I want to introduce Bob Zellner here, who's walked with me. He's taken 90% of the steps. It's 540,000 steps all the way. We've probably taken 520,000. Man, it's been quite a struggle. Bob is a civil rights legend. Used to work with Martin Luther King and Rosa Parks, and was a leader of SNCC back in the really tough days of civil rights. And it's been an absolute pleasure and dream to walk with him this trip. I told him, I was listening to him tell a story, and I said, you're just old flaming liberal, aren't you? He said, no, I'm a radical.
Get to the root of the matter.
I appreciate you all coming out, because there are some serious issues that we're walking about. The first issue, many of you are out here because of, and that's Medicaid expansion. The state of North Carolina has not accepted Medicaid expansion, and neither has Virginia. And what it does is it takes our tax money that we're paying and takes it away from our state, because we're already paying. In North Carolina, we've paid about $2 billion for Medicaid expansion. Those revenues are there, and they're not coming into our health care system in North Carolina. Now, when your health care system has $2 billion less revenues, you don't think that has an effect? It has an effect. In Virginia, you got a similar issue. So not only are we losing these revenues, these $2 billion, but indigent care for people who can't pay, who are too poor to afford health insurance, those reimbursements to hospitals are falling. So the way the Affordable Care Act works is you've got these indigent care reimbursements that are falling, and Medicaid expansion was put in place to cover those shortfalls. Well, if you don't accept Medicaid expansion, not only are you not getting these extra revenues, but you're actually losing revenues for what you had in the past. And what happens with rural hospitals are that they struggle to break even every year. And every year you have to have foundations work hard to raise money to help these hospitals survive. And most importantly, you have critical access hospitals, critical by the government, classify them critical access hospitals all over the country. Those hospitals are located in areas where the geography is so big and they're so sparsely populated that the government goes in and says, hey, these people do need some health care, they need emergency rooms. So the Hill-Burton Act back in the 40s started putting hospitals in these areas. Well, now what's going on is these big health care conglomerates are coming in and buying these little hospitals and closing them. Like in our community. In our community, we had a hospital that was failing. It was losing, the last year the community had, it was lost about $1 million. Well, the reason it lost $1 million is because the board was made up of a bunch of local people who weren't necessarily business people, and their friends were working at the hospital. So they had 129 employees at the hospital when really they needed 55, and they were losing money. So they took our hospital and they gave it to Vidant Health, a big healthcare conglomerate where all of our heart surgeries and cancer treatments and all that go. So Vidant Health took over our hospital. They didn't buy it. They got $1 million more assets and liabilities when they took over the corporation. So basically, we gave them $1 million to take our hospital. That was September of 2011. And they promised in a contract to strengthen and maintain our hospital, add services and all these wonderful things. 2 years later, September 2013, I got a phone call. And this phone call was from a TV reporter that said, would you like to comment on the hospital closing? I knew nothing about it. There was no time to talk about, can we do something different, or hey, we're struggling at the hospital. It was just, boom, they're going to close our hospital. So we went to fighting. Well, as we went along, we found out that Vidant Health in 2012 made $127 million. In 2013, they made $109 million. They got $550 million of reserves. By the way, I didn't mention they're a nonprofit. A nonprofit making over $100 million a year in a in Northeast North Carolina, where their mission is to provide health care in Northeast North Carolina. They're making over $100 million a year, over $500 million in reserves, and they want to close a critical access hospital? That's wrong. That's why you have laws. You have laws because some people would go in your house and steal your stuff and have no problem with it. And so we have laws for that stops people, and we'll send you to jail for that. Well, basically, we've had our health care stolen. Vidant Health came to our town and has taken our health care, and people are dying. We've already had a lady, Portia Gibbs. I wish, is my mother here? Mom. Portia Gibbs, I need the picture. I don't want to forget that. Mom is dynamite now. Mom, any other woman in this country would have shot Bob and I by now. Is that right, Bob?
I know.
She is so patient. Oh, but anyway, we love her.
She's been a real mom. She got sympathetic blisters on her feet. She's driving the car.
She even got blisters driving the car. But anyway, Portia Gibbs, we had a situation here 4 days after the hospital closed. 48-year-old lady, 3 kids, you know, and a husband. Nice lady, well thought of, down in Hyde County. Hyde County is the county next to us. We're in Beaufort County. Hyde County is the county next to us. They don't have a hospital or a doctor in the whole county. And all of them to come to our hospital, which was 30 minutes away from where she ended up. So she had a heart attack. She was having chest pains. Her husband put her in the pickup truck and ran her to Swan Quarter to the paramedic station. So the paramedics get her in the back of the van, and oh, there's no emergency room in Belhaven. Now in the past, what they would do is give her nitroglycerin and run her to Belhaven fast as they could, and then she would get there, and an ER physician who's trained in that would use his tools and medicine to save her, which they do all the time, all the time. Well, when she went to the paramedic station, the paramedics, all of a sudden there's no hospital in Belhaven. So now it means it's an hour trip to a hospital. So they call for a helicopter. Well, the helicopter takes an hour to get to her. As the helicopter was landing and the ambulance is parked in a high school parking lot, she expired. So she spent an hour in the back of a paramedic's ambulance. This is her. She spent an hour in the back of the ambulance in the parking lot at Mamsky High School instead of spending 35 minutes of that hour at the hands of an ER physician. That's real life right there. That lady is dead. That lady might not be dead. 3 kids don't have a mama. All right? So people say, oh, well, they're just shutting hospitals down, no big deal. No, it's a big deal. People die. This lady's got a husband who's crying. You go online, YouTube, listen, watch the interview, rip your heart out. She's gone. So why do we walk to Washington, D.C.? That's why. We got a greedy, corrupt, immoral organization that's come to our town and taken our hospital. And they blame Medicaid expansion, which has something to do with it. When you look at Vidant Health and how big they are with 9 hospitals, by Medicaid expansion not being accepted, it means millions and millions and millions of dollars to them. And that's true. But when you're making $100 million a year, you shouldn't be shutting down hospitals when you're a nonprofit who has a mission of providing health care in Northeast North Carolina. Now, to this day, there is not a person in power who has sent a letter to Vidant and told them to get their act together. The governor of North Carolina won't meet with us. Now, I'm not the governor of North Carolina, but if I was and there was a hospital in the mountains of North Carolina and I heard an entity bought them and was making $100 million a year and was going to close a critical access hospital, I would get my little highway patrolman and I would go down there and I'd get in the middle of that. Wouldn't you? Wouldn't you? If your citizens were going to die, would you let somebody do that? And you know, this isn't the private sector. The fact is Medicare and Medicaid are the major payers for health care. Government is already in health care. So to let some private decision take place that takes health care away from people is wrong. And we need to stop playing politics with it. This is an issue that people need to come before politics. The Republicans in my state, many of them kind of support me in a way. They don't fight with me at all. And I think one of the major reasons is there's no real argument against accepting Medicaid expansion. And I'm afraid that my Republican colleagues in North Carolina are going to get killed this fall because of Medicaid expansion. There's 500,000 people in North Carolina that could have insurance coverage the next 2 years and not cost the state a dime. And the state's not accepting that. Now, if you're representing the citizens, how can you not do that? Okay, now the next year, the third year, it goes to 95%. The government pays in 94, 3, 2, 1, 90, and it stays at 90. Well, I don't see how you can represent the citizens of North Carolina and not accept that, because guess what? If you don't like it after 2 years, and those 500,000 have had care because of taxes that we've been paying, and they've had care, and you don't want to do it anymore, you can opt out at any time. Virginia can do that too. The governor of Virginia told me he had a letter from Secretary Sebelius sent to show them that they could get out at any time. They still won't accept it. So I think we got an issue where Republicans have dug their heels in on an issue that they need to rethink. And I don't want to rub anybody's face in anything, because it's an issue that all of us have to work together. It's not a Republican or Democrat issue and this lady starts dying. All right, now if you're doing something that's causing this lady to start dying, you got to rethink what you're doing. And what I'm hoping to do on this walk is run into the person in power. We're hoping to meet with Secretary Burwell, who is head of Health and Human Services now. There's a good chance we're going to get to actually sit with that secretary. But sooner or later, there's got to be somebody that's got some power that says we're not going to do that. You're not going to be a non-profit and make $100 million a year and take health care away from people in the United States of America and keep your non-profit designation. That's immoral. And pass this around, if you will, while I talk. And I'd like to also say this. We're also walking because we'd like to see a bill introduced where if a critical access hospital is going to be closed, that the Health and Human Services Secretary has to sign off on it. So the government has to sign off for you to close a critical access hospital. It shouldn't be up to some private entity to decide if 20,000 people are going to have an emergency room. That is illogical. Well, the other thing we want is we want at least a year for communities to save their hospitals. If some conglomerates come in and bought a hospital and they ever want to close that hospital down, they should have to provide a year notice before they do it. Now, I know there's got to be some technicalities worked out, but that's important to us. We're walking for all rural America. I know there's a lot of people in rural America that have the same situation we've got going on. I know here in Virginia you've lost a hospital. I forget which county it was. One of y'all might know. Lee County. They lost their hospital. Well, I don't know the situation there. Now let me say one more thing before I take some questions or let Bob say something. If we had a hospital that was going to lose $2 million a year from here to eternity, I would not be up here. I wouldn't be walking to Washington, D.C. So the town back in January of this year had a business plan done. We paid $30,000 to a health care management company to come in and do a business plan, working with Vidant to get numbers. We found out that our hospital can break even. They had 129 employees, they needed 55. They had 49 beds, they needed 10. So by making those cuts and right-sizing that hospital, the hospital could break even. The other thing is, in the Affordable Care Act, there's also a provision called Accountable Care Organization. This is something that's new that is really hot. The foremost expert in the United States of America, who set up more ACOs than anybody else in the country, lives in Raleigh, North Carolina. And he called me, Bo Bobbitt, he called me about last November and said, don't let them close that hospital. That hospital can survive. Do not let them close that hospital. All you need is an ACO there. You got the perfect environment for it. Well, using the ACO model, which the ACO basically is a provision in the health care plan where the government says, okay, we've got this health care community. So you've got doctors, the hospital, the pharmacies, nurse coordinators. So you got all these people, and what you do is you've got to have at least 5,000 Medicare patients. So let's say in our area, which we have 5,000 Medicare patients. Well, our doctors sign up to the ACO, the pharmacy sign up to the ACO, the hospital signs up to the ACO. Well, those 5,000 people, the federal government knows that, Medicare knows, that they're going to spend about $10,000 a person on that population of Medicare patients. So that's $50 million. So the government says, okay, we know we're going to spend $50 million on average on these people. If you can save us some money, we'll split it with you. So this organization of doctors, pharmacies, hospital, and all this start working trying to save the government money. And they do it through people taking blood pressure medicine, making sure they're taking it, people that have had strokes, looking after them, making sure they're doing what they're supposed to do, diabetes patients, looking after them, people about to have heart attacks, whatever, catching them early. They do all these things to try and cut costs. Well, that $50 million that the government is going to spend on Medicare, let's say they end up spending 45. So you save the government $5 million, they split the money with you. So they give $2.5 million to the ACO. Half of that money goes to the hospital. So all of a sudden you got another $1,250,000 in that scenario that hits our hospital. So now all of a sudden, instead of a hospital that breaks even, now we've got a hospital that's making money. And the most conservative projections with our business plan, our hospital in year 2 makes like $43,000, and year 3 it makes $500,000, and it takes off from there. So we don't have a hospital that can't function, that's going to lose $2 million into the future forever. We have a hospital that could survive. We have a big conglomerate that doesn't want it to survive because they want to close our hospital and force people to their other hospital, you see, consolidating. And that, you can't have private business doing things like that in public service. It just doesn't make sense. So I'm all for private enterprise. You know, I'm all for competition. And what Vidant is doing is eliminating competition. They're getting monopolies. That's what they're doing. Well, we need to open it up with these ACOs and have competition.